So that is a kind of repeated PYQ that has been asked time and again related to radial nerve, ulnar nerve or the median nerve. Gauge from where the questions are coming, because the basic difficulty in medical science optional is that it is very difficult to understand the syllabus and understand from where the questions are coming. So since this question has been asked, we need to study about the perineum anatomy in detail, like what are the components of superficial perineal pouch, what are the component of deep perineal pouch. So hello everyone, I am Yashvardhan Singh. I got rank 212 in UPSC CSE 2025, and previously also I was recommended twice by UPSC in the year 2022 and 2023. And I appeared 4 times in the UPSC interview in 4 attempts. And in all my 4 attempts, my optional has been medical science. I did my MBBS from King George's Medical University, Lucknow, and I completed it in the year 2023. My internship completed in the year 2023. So today the basic purpose of this discussion is to how to demystify the medical science optional syllabus. There are certain issues related to medical science optional. One is that there is lack of guidance, there is lack of clear understanding that what is the syllabus of medical science, how questions are asked, or whether questions are asked directly from the syllabus, or sometimes the questions are also asked outside the syllabus also, and how the questions are related to syllabus. So the basic purpose in this video, in this discussion, will remain to discuss we will discuss 2025 paper, and we will try to correlate and understand that how questions in 2025 paper were directly related to the syllabus that was prescribed by the UPSC, and how it sticks to the syllabus that has been there. Some certain issues in the medical science optional is that sometimes we do not understand that what is the actual demand of the syllabus. There are certain headings that are given in the syllabus. We need to understand that what are the various subcomponents of that heading. So we will try to understand this through this question paper. So the first question that was asked in UPSC 2025 paper 1 was that of, we all know that question number 1 and question number 5 are compulsory question. We have to mandatorily attempt those questions, and out of the remaining questions we have to choose any 3 questions. So we will look one question, the first question, that is related to describe the formation, course and branches of ulnar nerve. Which muscles do each of the branches supply? Why is the ulnar nerve called the magician's nerve? So as we can see, there are some certain subcomponents of the questions. First, broadly, this question is related to the ulnar nerve. But there are certain specific headings, subheadings that has been provided in the question itself. First is we have to discuss about the formation. Second is related to its course. And secondly is the branches. What are the branches of the ulnar nerve? The second part of question is related to what are the specific muscles that are supplied by the ulnar nerve. Third part of the question is that is reason kind of question, that why ulnar nerve is called as the magician's nerve. So we have to give the music, what the reasoning behind it. Now we will try to understand that what is the exact part of the question that from where it was asked. If we see the syllabus, the first heading itself says the nerve supply of upper and lower limbs. In the upper and lower limbs, 3 commonly most asked questions have been about the individual nerves: ulnar nerve, radial nerve, and median nerve. These questions have been repeatedly asked multiple times. In the previous year, they asked about the radial nerve, the nerve supply of the radial nerve. The headings, subheadings remained the same. The only thing that was, in place of ulnar nerve, they asked the radial nerve. So that is a kind of repeated PYQ that has been asked time and again related to radial nerve, ulnar nerve, or the median nerve. So that gives us the idea that whenever we study the nerve supply of upper and lower limbs, first we have to study the individual nerves. For example, for lower nerves, we must study the sciatic nerve, its distributions, its clinical aspect, its branches. And when we are studying about the broader nerve supply of upper and lower limbs, we have to also study about the dermatomes of upper and lower limbs. So this is the hint that is provided in the syllabus itself, that when we are studying about the nerve supply, our reading has to be comprehensive. Similar to we talk about individual nerves, one repeated questions has been about the dermatomes. it has been asked multiple times about the dermatomes of the upper limb and the dermatomes of the lower limbs. So this is the direct source of the question. The first heading itself is the source of the first questions of the year 2025. Now moving to the second question, if you see the second part of the question, why it is called as the musician's nerve. So we have to give the reasoning that why it is called as the musician's nerve, because it supplies the muscles, that is the intrinsic muscle and the smaller muscles that are ultimately responsible for playing instruments such as guitar. So this is the reasoning that is behind that why it is called as the musician's nerve. Similarly, other nerve is called as the laborer's nerve. This can be the next year questions, that why this particular nerve is called as the laborer's nerve. Now moving to the second questions, that is name the nerves and their branches that supply the sole of the foot, stating the specific area of their distribution. Explain in brief what is Morton's metatarsalgia. Now, I told you about that dermatomes of lower limb have been repeated questions, and similarly, this nerve supply of sole has been asked in the previous year also, where they categorically asked about the nerve supply of the sole. So here we have to talk about what are the different nerves that supply the area. So the basic approach can be in this question can be we can directly draw both the surfaces of the sole and we can directly map out what are the nerves supplying the different areas. There are around, if I remember correctly, there are around 7 nerves which supply the different areas of the sole. So since this is the repeated questions, we need to be aware about what is the nerve supply of sole. But coming to the second part of questions, explain in brief what is Morton's metatarsalgia. This was the question that is not covered in any sources. Any sources, by any sources, I mean the standard source that we study during a NEET PG preparation or during the optional preparation or during our MBBS preparation. So the Morton's metatarsalgia was one term that we were not aware, but anyhow we could write the other aspect of the clinical anatomy of the nerve supply of the soul. But here I've been seeing that these two questions, nerve supply of ulnar nerve and the nerve supply of the soles, these are the repeated questions that have been asked previously. And if we talk about these questions, explain in brief what is the Morton's metatarsalgia. Remember in question number 1 and 5, there will be certain questions that will be kind of bouncers. They will not be covered under syllabus, and this happens in each and every optional. It is not limited to the medical science optionals. One question in question number 1 and question number 5 will be mostly from out of the syllabus. This is the standard pattern. So you need not to worry about from where this question was asked, what was the source of these questions. We know if we know this question, well and good, otherwise nothing to worry about. Now, this third question, this question is directly from biochemistry. And also this is the standard pattern. If we see the question first, there are 5 parts of it. First 2 questions are related to anatomy. Second is question is related to, third question is related to biochemistry, and next 2 questions are related to physiology. So this is the standard pattern that is followed, that questions from all the subjects will be there in the compulsory questions also, so that it means we cannot skip any subject that is mentioned in the syllabus. This question is related to classify jaundice according to its etiology. Make a tabular representation of the blood, urinary, and stool finding observed in the different types of jaundice. So here, broadly, we have to talk about the jaundice on the basis of etiology, like pre-hepatic, hepatic, and post-hepatic. And also, we have to list down, we have to give the tabular findings, that what will be the findings in the blood, urinary, and stool in different type of jaundice. So this is the directly question, because if we see the syllabus, it is directly mentioned that if we see the syllabus of biochemistry, it is directly mentioned organ function test, liver, kidney, thyroid, and protein synthesis. This protein synthesis is the separate topics. If we see the organ function test, liver, kidney, thyroid. So it means thyroid functions test, renal function test, and the liver function test need to be studied. So this is the direct questions that has been asked, and this is also a repeated question that has been asked multiple times before, that what is the difference between other kind of question can be that they might themselves give the clinical findings, like the stool findings are like this, urine findings are like this, what is the probable cause of this particular pathology? So in that question we have to identify that whether it is prehepatic, hepatic, or post-hepatic, and also we have to give the reasoning. So there can be both type of questions that can be asked. Similarly, if we look about the other two kind of tests, like kidney function test and thyroid function test, there can be two type of question. First will be direct questions, where they will ask that what are the various components of thyroid function test. Second question can be of clinical questions, where they will give findings like TSH value is this, T3 value is this, T4 value is this, what is the probable diagnosis. So thyroid function test, kidney function test, and liver function test need to be studied in detail, because this is the question that is asked almost every year or every alternate year. This question is also directly related to the syllabus that has been prescribed. The best approach for this question is that we can make three columns. In one column we can write pre-hepatic, we can write hepatic, and then we can write post-hepatic, and we can give various findings that will be present in those particular diagnosis. Now the fourth question that is related to the physiology, and this question is that describe the process of generation and conduction of nerve impulses in the humans. I had a note on the saltatory conduction. Remember, if you see the syllabus of physiology, it is directly mentioned that the nerve muscle physiology is the part of the syllabus that has been directly mentioned. So in nerve muscle physiology, we need to study from the basic aspect of nerve physiology, that how nerve impulses are generated, action potential, how action potential is generated, how it ultimately transferred to the muscle, how the signal is transferred to the muscles, and what is the mechanism of muscle contraction, both neurotransmitters, what are the neurotransmitters involved, what is the process involved, and after that we have also see the what is the molecular aspect of muscular contraction, like influx of calcium, formation of cross bridges, utilization of ATP, and after that ATP is also released for breaking of that cross bridge that has been formed. So that whole process, right from transmission of nerve impulse to the ultimate contraction and relaxation of fiber, is question that has been asked multiple times. In that case, since nerve muscle contraction is a very vital topic, so we also need to understand what are the subtopics of it. Because if we see the saltatory conduction, we have studied that what are the benefits of saltatory conduction, how it increases the speed of transmission, etc. Similarly, in the nerve muscle contraction, there can be some other clinical kind of questions also, like what is the physiology of rigor mortis, also what are the various chemicals and what are the various poisons that affect and that blocks the process of neuromuscular transmission. So one question can be that of explain the process of muscular contraction, and the second question may be like that 3 marks question, that add a note on saltatory conduction. One year the question was that what is the absolute refractory period and what is the relative refractory period. So what I am trying to say is that we need to read the whole heading of nerve and muscular contraction and what are the subcomponents of it. What are the various graphs that are made in the nerve muscular contraction? What are the different reasoning based questions that can be asked? One question that was asked is that was related to why cardiac muscles cannot be tetanized. So the basic question, the basic physiology behind is that is related to the refractory period, the absolute refractory period and the relative refractory period. So this was a kind of reasoning question that was asked a few years ago. So in the broader heading of if we will see this question directly saltatory conduction, we will find that this question is out of syllabus. But actually, this is not out of syllabus question. The genesis of this question lies within the syllabus itself. When we are studying nerve muscle physiology, we have to study saltatory conduction. We have to study rigor mortis. We have to study the pathological condition also, different type of myopathies that can occur. Previously, the question was asked related to myopathies also. So this is the basic idea of this video also, that how we can deconstruct the syllabus for our own benefit, and how by deconstructing the syllabus, how we can gauge from where the questions are coming. Because the basic difficulty in medical science optional is that it is very difficult to understand the syllabus and understand from where the questions are coming. If we are able to understand that what is the actual source of questions, the learning process becomes a bit easier. So that is the whole purpose of making this video. That is what I am trying to do in this particular discussion. Now, third question is related to, with the help of, the fifth question is that, with the help of suitable diagram, explain the innervation and functions of muscle spindle. Now, if we see this directly, it might seem this question is also out of syllabus, because muscle spindle as a keyword is not mentioned in any part of the syllabus. But if we see the syllabus of physiology, yes, the human physiology syllabus says the conduction and transmission of impulse. This was the source of the fourth question, that the D part of the question, that conduction and transmission of impulse, mechanism of contraction, neuromuscular transmission. However, if we see the other part of question, that is related to muscle tone. And we all know that muscle spindles are ultimately responsible for maintaining the muscle tone. So if we are studying the muscle, the process of whole physiology of muscle tone, we have to study that how the muscle spindles are related to it, how the innervation of alpha motor fibers and gamma motor fibers is different, and how that muscle spindles are responsible for maintaining tone. What is tone? What is the purpose of tone? And also we have to study what are the different pathological conditions related to tones, like hypotonia, hypertonia. In which condition the tone of body is decreased. The next question can be clinical question, that suppose there is an injury at such and such brain level, do you think that the tone of the muscles will increase or decrease? So this can be the next clinical questions. So first we will study what is tone, what is muscle tone, what is the physiology of maintaining muscle tone, what are the various structures that are present in maintaining the muscle tones, and what is the pathological and the clinical aspect of tone. This is the source of the question that has been asked related to the muscle spindle. Now we see that the question number 2, the first question is compulsory. We have, all of us have to attempt the question number 1 and question number 5, and out of the remaining questions we have to choose any 3. If we see the second question of the year 2025, I did not attempt this question, because the reason for this is that I was not having the idea this question was related to. This question was of 15 marks, and it was asking about, using a bell level diagram, trace the taste pathway from the circumvallate papilla of tongue to the cerebral cortex. It was a kind of difficult question, very difficult question, because it is very difficult to trace the whole pathway starting from circumvallate papilla and going right up to the cerebral cortex, and we have to write this question around in 3 pages. So it is very difficult. I feel that for me it was a very difficult question. I could not write it, I could not attempt it, so I did not choose this question. However, if we see, there are certain headings in the syllabus where this question can be traced back. One is the tongue. We have to read about the nerve supply of the tongue. This is the, in a way, it can be says that indirectly this question is related to the aspect of tongue that is mentioned as a syllabus in the anatomy. But however, I did not attempt this question. The second part of this question is that, enumerate any 5 tests for the assessment of renal tubular function. Explain the underlying principles and their interpretations. Renal tubular function, A few moments ago, we discussed the question that was related to the liver function, and now we are discussing about the renal function. So we can understand that how questions are asked repeatedly to the keywords that have been mentioned in the syllabus. In the same paper, one question has been asked related to liver function, and the second question has been asked related to the renal functions. And it is asking about any 5 tests related to the renal tubular functions. So when we study about the renal function test, there are different type of tests that can be done. One are related to the glomerular functions, other are related to the tubular functions. Here they have specifically asked about the tubular functions. So we have to enumerate those tests, and we have to also explain what are the principles and their interpretations. This question is a kind of wider question. In the renal function test itself, there can be narrower questions that last year it was asked. I think that the question was related to what can be the gold standard for the renal function test. Like what are the basic difference when we take urea or creatinine as a standard for it. So the basic questions that we used to study during our prof examination, that why urea can be a gold standard, what are the differences that come when we use inulin or when we use creatinine. So the kind of reasoning standard that we used to prepare for our viva and our professional examination are also repeated here also. The kind of the methodology of asking the questions remain the same. But however, I did not attempt this question. I skipped the whole second question. Now this question is related to, the second part of this question is related to biotin. If we see the syllabus of biochemistry, the vitamins and minerals is mentioned as the keyword. So that means that we have to study all the vitamins, right from vitamin A, B, C, D, E. And also, if we see the questions related to biotin, it has been a repeated question. It has been asked related to how, once it was asked that how raw egg inhibits the absorption of biotin. The question was formed in that sense. And this year, the question was asked that was related to the explain the role of biotin in the intermediate metabolism with a suitable example. Add a note on the mechanism of action of any biotin antagonist with its application in medicine. Now we see that although this question is related to biochemistry, but the clinical touch has been given. This question we will also see in the process in the syllabus of protein synthesis. There also the first part of question is always related to explain the process of protein synthesis, where we have to explain the whole process of translation. And also sometimes they ask that what are the various antibiotics that inhibit this process. So we have to talk about various antibiotics such as tetracyclines, etc., chloramphenicol, that how these specific antibiotic affect specific stage of protein translation. So it is a kind of understanding that we get, that questions, although they are related to physiology, anatomy, and biochemistry, but somehow they are also trying to correlate it with the clinical approach also. Now, the next part of the question is that question number C. Question C is also the part of question 2, and it is all asking about define cardiac output and describe the regulation of cardiac output in normal adults. Add a note on cardiac index and cardiac reserve. Cardiac output as a keyword is directly mentioned in the syllabus. I can also show you, and you can also have a look on your syllabus that cardiac output is mentioned as a keyword in the physiology syllabus. And when we ever study about the cardiac output, the next heading is that of cardiac index. And cardiac index is basically about how cardiac output is related to the surface area of an individual. Cardiac index has also been asked previously. So this again is a previous year question. Cardiac reserve is basically about what is the excessive cardiac output that can be generated in the situation of emergency, or we can say how athletes are having higher cardiac reserves that can be utilized in situation like when they are performing during athletic meet, etc. So this, whenever we study cardiac output, the next heading is that cardiac index and cardiac reserve. So I will show you the syllabus. The broader heading is that of blood, and this heading is that of cardiac output. And cardiac index and the cardiac reserve is the subheading under this broader heading of cardiac output. Blood pressure has been also a question that has been asked multiple times. Questions related to the short term and long term regulation of blood pressure, regulation of cardiovascular functions. This is the source that why questions related to how to regulate cardiac function was asked, cardiac output was asked. Because when we talk about cardiac output, we talk about cardiac output is equals to heart rate into stroke volume. And there can be certain factors which will affect the heart rate, and there will be certain factors which will affect the stroke volume. And ultimately, there can be sub factors affecting stroke volume as well as heart rate. So we have to discuss all those in these questions related to cardiac output. This question is already directly covered from the syllabus. The next question, the last question of question number 2, is that of define systemic vascular resistance and list its determinants. Briefly explain the role of its determinants. I personally find this question is quite difficult because we do not explicitly read that how to define the systemic vascular resistance and what are its components. And also we have to determine what we have to comment upon, we have to write briefly and explain it what are its determinants. So personally I find this question was also a bit difficult to explain. First we have to define systemic vascular resistance, and when we have to tell about its determinants. So personally I found this question difficult, so that was the reason that I did not attempt this question. But for someone who has read the systemic vascular resistance, its determinant, it could be done. And also if someone is very confident about this aspect of taste pathway from circumvallate papilla to the cerebral cortex, they were knowing the exact pathway, what are the subcomponents of it, what is the clinical anatomy of this pathway, they could also have attempted this question as well. Now the third question is related to anatomy again. If we see this question, there is a heading. I will show you the syllabus. There is a subheading under syllabus of anatomy that says applied anatomy of perineum. This is the direct source of the questions, that they have created a clinical scenario and they have that indirectly asked the applied anatomy of the perineum. As far as I have knowledge, this topic of the syllabus was asked for the first times. There have been certain questions related to perineum, but I don't think that there was a large question of 10 marks or 15 markers. So I think that it was only second or third times that this question related to perineum anatomy was asked. So basically, it is a clinical scenario that has been given. A 36-year-old cyclist suffered pelvic energy while riding into a pothole on the road. Following this incident, he has severe pelvic pain and unable to pass urine. His retrograde urethrogram shows contrast limited to superficial perineal pouch. So since this question has been asked, we need to study about the perineum anatomy in detail, like what are the components of superficial perineal pouch, what are the component of deep perineal pouch, what are the structure that pierces the perineal membrane, sterorectal fossa, the contents of the sterorectal fossa. So that aspect of anatomy we need to study in detail. This is a 20-mark question and it broadly covers the whole anatomy of the perineum. What is the most likely structure and its site of involvement? Which is responsible for its inability, his inability to pass urine? What are the parts of the principal structure involved? With the help of level diagram, illustrate the difference in the contents of superficial perineal pouch in males and females. If we see our professional examination, whenever the question related to perineal anatomy is asked, this is the standard question, a kind of standard question, that what are the differences in the content of superficial perineal pouch in male and female, what are the content of superficial perineal pouch and deep perineal pouch, what are the structure piercing perineal membrane, sterorectal fossas, boundaries of sterorectal fossas, and the content of the structural sterorectal fossas. So when we study about this perineal anatomy, we need to study these aspects. Now this question, selenium. is related to selenium. Remember, I told you that vitamins and minerals is a keyword that is mentioned in the syllabus of biochemistry. However, it is difficult to study selenium because whenever we study about the minerals, we study iron, we study copper, we study zinc. To study selenium is not that usual and routine kind of thing. But however, we also need to look into previous year questions. Selenium has been asked in previous year questions. So selenium becomes very important for that reason. If the question has been asked in the previous years, it can be asked again. Like selenium was asked and it was related to what are the clinical conditions that might arise due to the excess and deficiency of the selenium. This year they have broadened this question and they have also asked about the dietary sources of selenium, its biochemical roles and its deficiency diseases with clinical manifestations. So now when we know that one particular question has been asked, one particular question has been asked in previous year, we need to study that question in detail. Like earlier the dietary sources, I think the dietary sources were not asked, but this year they have asked dietary sources also. So like we study dietary sources of iron, we study direct dietary sources of zinc, we study direct dietary sources of iodine. So in that similar way, if question has been asked in the previous year, we need to study that dietary source of that particular mineral also. And also we might not need to study each and every mineral, but there are certain minerals that are important as such, like iron, iodine, but also there are certain minerals that prima facie might not seem to be very important for professional examination, but they have been asked, like selenium has been asked, chromium has been asked, the role of chromium in insulin resistance has been asked. So these previous year question becomes very important for predicting the future year question also. The next question is that of restriction fragment length polymorphism has a number of application in clinical medicine. Briefly state any three. I will show you the direct source of this question in the syllabus of biochemistry. There are three technologies that are mentioned. One is restriction fragment length polymorphism. Second is polymerase chain reaction, and other is radioimmunoassay. Out of three technologies that are mentioned, the question was asked about the RFLP, and in the subsequent question we will see the question has also been asked about the radioimmunoassay. So in a single paper, the question related to RFLP and RIA both have been asked. This tells about the significance of the keywords of the syllabus. So this question is also directly from the syllabus. RFLP is very much part of syllabus. This question, this is related to write with the help of suitable example, explain the second messenger mechanism that mediate the downstream action of hormones inside the cell. Although this is also mentioned in the syllabus, but I think this is for the first time that this has been asked as a questions. We have studied during our professional examination, there are different kind of hormones. Some are protein hormones, some are amino acids, some have their receptors on the cytoplasm, some have their receptors on the cell membrane, some have nuclear receptors, and how secondary messengers are involved in the functioning of certain like cyclic AMP, calcium. That pathway we have studied, like DAG pathway. This is part of syllabus, but this was not, as far as I remember, this was not asked previously. This is also mentioned in the syllabus. We will see this also when we will go to the syllabus. This last question, that is about give a brief account of synthesis, storage, secretion and function of the posterior pituitary hormones, directly from syllabus. I will show you. See, endocrine system under human physiology, mechanism of action of hormones, means the first question that was related to secondary messenger, etc., that comes under this heading. Second is related to formation, secretion, transport, metabolism, function and regulation of secretion of pancreas and pituitary. This year they have asked related to the posterior pituitary. Earlier they have asked about the various kind of cells that are present, like acidophilic cells, basophilic cells that are present in anterior pituitary, and also they have asked what are the different hormones that are secreted from the anterior pituitary. And also when question is related to the posterior pituitary, we can also talk about that hypothalamus and posterior pituitary axis that exist. And we can also talk about what are the role of these hormones that are secreted. Now moving to the fourth question. This is also a question of anatomy, but it has been presented in the form of clinical scenario. A 55-year-old lady visits surgery OPD with a 3-month-old history of painless heart swelling in her left breast. On examination, it is found that the swelling is firm, immobile, and is located in upper inner quadrant along with the retraction of nipple. She is advised to undergo preoperative sentinel lymph node biopsy and surgery. Explain the anatomical basis of preoperative sentinel node biopsy in this case. Mammary gland is an important topic in the anatomy and also in the surgery. We have studied in our surgery that how sentinel lymph node biopsy is a very important tool to understand the spread of metastasis or the spread of cancer that has occurred. So in that they have linked that how sentinel lymph node, we can say that in this question they are indirectly try to ask that what is the lymphatic drainage of mammary gland, and mammary gland as a topic is directly mentioned in the syllabus of anatomy. So this question is somehow directly related to the syllabus, that they are asking indirectly what is the lymphatic drainage of mammary gland and how it affect sentinel lymph node biopsy. That sentinel lymph nodes are the first draining nodes, the kind of concept that we study if sentinel lymph nodes are found to be negative, and how, and if sentinel lymph nodes are found to be positive, how it affects the interpretation. So it is related to the lymphatic drainage of mammary gland. Now this question, this again is a question of anatomy with a clinical scenario given. This is basically a question related to knee joint. Remember in our syllabus there are three joints that have been mentioned. One is the shoulder joint, other is the knee joint, and third one is the hip joint. So alternate year they are asking question. One year they ask the question related to shoulder joint. Next year they ask related to knee joint. This is a question of anatomy with a clinical scenario given. Basically a case of knee injury, and certain clinical findings have been given. A 45-year-old man presents at orthopedic OPD with swelling and painful right knee. He gives a history of fall while playing cricket 2 weeks ago. On examination, his right knee has tenderness, swelling, decreased range of mobility, and anterior joint instability. His MRI scan reveals damage to one of the major knee joint stabilizers. After this clinical scenario, two questions have been asked. Name all the ligaments and write their specific roles in stabilization of the knee joint. The second question is that name the most likely structure involved in given case and write 2 points to support your viewpoint. This is basically a question related to orthopedics and also to the anatomy. I have worked in a department of sports medicine for some times, and basically the clinical findings that have been given are related to the anterior draw test and the Latchman test that we used to study about during our orthopedic posting. So basically, first we have to give the anatomical relation, that what are the different ligaments like anterior cruciate ligament, posterior cruciate ligament, what are different meniscus, fibular ligament, tubular ligament, which of the following ligament are intracapsular, other are extracapsular ligaments, how capsules support the joints. So basically we can also draw one of the diagram of knee joint, and we can represent different kind of ligaments that support knee joint structure. We can name them, and we have to also write the specific role. What is the specific role of meniscus? What is the specific role of anterior cruciate ligament, posterior cruciate ligament? Which of the following will provide the anterior stability, which will provide the posterior stability? This question has been asked in the previous year also, ligaments of knee joint. And also this is very important topic for our professional examination as well, ligaments of knee joint. Also name the most likely structure involved in the given case and write 2 points to support your viewpoint. Here we can write about whether do you think by your clinical findings that whether anterior cruciate ligament has been injured or posterior cruciate ligament has been injured, or this is the injury of menisci, etc. And also we have to give our clinical findings. Like clinical findings, we can put from there that anterior draw test is positive if we know the name of test, Lechman test is positive, and also we see the range of the kind of soiling, decreased range of mobility. It also point out to a kind of ligamental injury, as I discussed this topic from one of the consultant of sports medicine, that these points can give us the idea that this is the ligamental injury. As I was talking about that after RFLP, the next question is related to radio immunoassay and outline its diagnosis, role in the diagnosis of thyroid disorder, and a note on the advantage and disadvantage of this technique. This is also directly a question that has been asked from the keyword. They asked RFLP earlier, and in the next question they have asked about the radio immunoassay. Basically, we can mention that what is the principle of radio immunoassay. We can also draw a graph that how the concentration is related to radio fluorescence that will be observed, and also we can explain the role of RIA in different kind of diagnosis of thyroid disorder. Here we need to see that in the next question they can ask the role of RIA in the disorders of pancreas, but the basic principle will remain the same. We can talk about how it can be helpful in finding the antibodies, different antibodies which we see in the Graves disease. We can also talk about how concentration of different hormones like TSH, T3, T4 can be estimated using RIA. First, we will explain the basic principles of RIA. We can draw a graph. We can draw the process also using the vials, how different vials are used, how we need to wash the vials after that, that whole process of RIA. After that, we will explain that how this RIA can be used in the diagnosis of thyroid disorder. And after that, we will use about the advantage and disadvantage, like radioactivity exposure is there in the disadvantage, like this requires a technical expertise. Everyone might not be able to do it. It requires infrastructure. It might be costlier. It might not be able to afford such infrastructure. This might be advantage. Disadvantages. Advantages can be that it is very precise. We can go up to the microgram level also to identify certain chemicals. So this can be answered in this way. Enumerate hematopoietic vitamins. Explain the biochemical basis of the deficiency manifestation of any two of them which led to anemia. Remember I talked about that vitamin is a keyword that has been mentioned. Earlier we saw that there was question related to biotin. The next question is also related to vitamin. Here they are talking about hematopoietic vitamins. We have to talk about vitamin B12, folic acid. After enumeration, we have to explain the biochemical basis of deficiency manifestation of any two of them which lead to anemia. We have to explain that how this vitamins are required for the DNA maturation, ultimately which are required for production of different kind of cells. We have to explain this process, that how if there is a deficiency, how that process of hematopoiesis will be hampered. And explain the biochemical basis of deficiency manifestation. We can also write about the deficiency manifestations. What will be the deficiency manifestation? Like we can give clinical manifestations like hyperpigmentation of knuckles, lethargy is there, the basic findings of anemia, and after that we can also give the cellular findings like megaloblastic anemia. What will be the label of whether it will be hypochromic or it will be hyperchromic anemia. So after giving clinical findings, we can also give about the cellular manifestation of it. And also we have to explain the process, the biochemical process that is required for the hematopoiesis and how these vitamins are relevant for it. The next question is that how will you differentiate between if this anemia is due to folic acid deficiency or this is due to B12 deficiency. So for that we run a certain number of tests, like we go to the molecule. I'm forgetting the exact name of the test, like homocysteine is one of the byproduct of these processes, and we try to do certain tests to identify whether it is related to B12 and or folic acid. And there can be other question also that why cooking leads to the destruction of folic acid. There can be that kind of clinical question also. The next question is that of briefly describe the development of cell-mediated immunity. List the cell types involved along with their actions. Immunity as a keyword has been directly mentioned in the syllabus. So here they are talking about cell-mediated immunity. How this cell-mediated immunity is developed. List the cell types involved along with their actions. We have to list what are the different cells. We can talk about different kinds of cells and how they are involved in that structure. So remember the basic keyword that has been mentioned. This is mentioned in the microbiology syllabus also, and it can be asked in the physiology as well, and biochemistry as well, because we study certain components of biochemistry in the immunity also. Also we study immunity in our physiology also. So that cell mediated immunity, humoral mediated immunity, active immunity, passive immunity, herd immunity. Once the question was asked related to the herd immunity, because that was in news due to COVID-19. I think it was asked in 2023 or 2022. So all these keywords related to immunity, that becomes important. And after that, in the subheading of that, the phagocytosis also becomes important. Remember, we can trace the source of this phagocytosis with the three. One is that is related to immunity subheading, and other is that inflammation is the keyword that has been mentioned as a part of syllabus in pathology. So phagocytosis is also related to inflammation also. So since this is a 5 number of questions that can be asked from that basis. The next question is that give an account of the formation and function of thrombocytes. Thrombocytes, that is related to platelets. First, we have to give about the formation, how it is formed, like how it is formed from the megakaryocytes, and also what are the functions of thrombocytes, like how it is helpful in hemostasis, what are the different kind of receptors that are present on thrombocytes, and how these receptors ultimately lead to hemostasis, primary hemostasis, secondary hemostasis. Once the questions in the hemostasis has already been asked related to what are the various factors that are involved in the process of hemostasis. And also one question was asked related to what is the structure of thrombocytes. So we have to draw a well-level diagram of platelets. We have to talk about what are the different cell organelles that are present. Basically, there are many fibers that are present. There are many granules that are present in platelets. So we have to do the labeling of that. So the thrombocytes have been a repeated question that has been asked. Now this section 5 question, this question number 5 of section B. Here we will have the question related to pathology, pharmacology, forensic medicine, and microbiology. In the section A, we were having question related to anatomy, physiology, and biochemistry. In this section, we will have the question related to these subjects. The first question is that enumerate the topical antifungal drugs along with their indication and side effects. Antifungal drugs is a keyword that has been mentioned in the syllabus. But it becomes a bit difficult because we do not study what are the antifungals that are specifically topical. We study antifungal drugs, different kind of antifungals drug like griseofulvine, etc. But to study specifically what are these topical antifungal and what is their indication and what is the side effect. So this makes this question a bit difficult. However, we can, on the basis of our knowledge that we have related to antifungal drugs, what is the different classes of antifungal drug, how different kind of antifungal drugs affect different structure of different type of fungi, we can answer this question. Although it is a bit difficult to say, personally for me, it was difficult to identify which antifungal drugs are specifically topical and what is their specific indication. So it was a kind of difficult, but basic on the basis of our knowledge of antifungal drugs, we can write something in this question. The second question is also related to antihelminthic drugs. Antihelminthic drugs is also one of the keywords that is mentioned. Drugs used in treatment of neurocysticercosis and also mentioned their side effect. This we study. This has also been a repeated question. This has been asked in the previous year also. that what are the various kind of anti-helminthic drugs, what are their side effect. So one, and also certain question has been specific also. I think that once they have also asked question related to albendazole specifically. So anti-helminthic drugs, broader heading, they can also ask about the specific drugs also under that subheading. The next question is that enumerate the cells of lymphoreticular system schematically represent the process of B cell maturation. This is also a bit difficult question because to enumerate all the cells of lymphoreticular system, we can talk about T cell, B cells, natural killer cells, but it creates a kind of confusion that whether we have completed all the cells or this is the question, this is the answer that need to be written. In exam environment, it becomes a bit difficult. So, however, what we can answer on the basis of the understanding of we have of about T cell, like different kind of T cell is there, T helper cell, T killer cell. I try to approach this question in this approach. Also, schematically represent the process of B cell maturation. And as far as I remember, this question is also that was asked for the first time, but for the subsequent year also it becomes very different. It becomes very important because they might directly ask, or they might ask for the 10 marks also, that what is the process of B cell maturation. We have to give specific process, like there is certain specific process of how B cell matures. Similar to this question, one question that has been asked in the previous year was related to autoimmunity and self-tolerance. Question related to self-tolerance has been already asked. And in this, they talked about B cell maturation. This is also related to immunity subheading of our microbiology syllabus. Immunity is a heading in the microbiology syllabus. So this question also comes under that immunity syllabus. And I understand that it becomes a bit difficult because immunity as such is a very wide topic. If we will go study into the studying each and every integrity of immunity, it becomes very difficult. However, the basic approach that will remain is that we should complete previous year questions, and also we should try to study the basic approach of immunity, like passive immunity, active immunity, different kind of cells that are involved. Since this has been asked in this year, B cell maturation also need to be studied. So although it is very difficult, we cannot study complete immunity because it is a very wide topic, but we have to answer on the basis of understanding that we have. This, the second part of this question is related to the make a schematic flowchart of pathogenesis of salmonella causing enteric fever. Mention two important categories of drug resistance in salmonella typhi. Salmonella and Shigella are the two bacteria that are mentioned in the syllabus. Last year or before that, there was a question related to Shigella. There was question related to what is the difference between Shigellic dysentery or amoebic dysentery, bacillary dysentery or amoebic dysentery, because both Entamoeba histolytica and Shigella, they are part of the syllabus. In parasites, we have amoeba, we have malaria, and also we have giardia in our syllabus. So this question related to Shigella and Salmonella has been asked multiple times. And in Salmonella, the Vidal test has been also asked several times, that how Vidal test is done, what is the scientific principle behind Vidal test, and what is its position as of now. Do we recommend Vidal test in each and every patient? So Salmonella, we have to explain what is the basic process of enteric fever. In most of our textbook and also our most of our coaching notes, this process has been explained, that right after ingestion, what is the process which ultimately lead to the enteric fever. So this question has been asked from the Salmonella typhi. Mention two important categories of drug resistance in Salmonella typhi. So although it is also a kind of difficult question because we do not remember what are the two important categories that are of drug resistance in Salmonella typhi, but then also in the coaching notes also they provide certain kind of resistance that is occurring in Salmonella typhi. So on the basis of that we can answer this question. But however, also in the time of exam pressure to identify what are the two important categories, it is a very difficult exercise. The question C is related to what are the risk factors for lung carcinoma. Describe the morphological features of three major histological type of lung carcinoma. In pathology, the lung carcinoma has been mentioned as a part of syllabus. So we have to talk about the risk factor for lung carcinoma. What the risk factor can be genetic risk factor, the other risk factor can be exposure to certain chemicals, third risk factor can be smoking can be a risk factor, and after that we need to move towards the different morphological features. And when we talk about morphological features, we have to give both the features, both gross feature as well as microscopic feature. In gross feature, we can talk about what are the structure involved, whether it is centrally located or it is peripherally located, what is its gross appearance, what is whether it is gritty or certain kind of other appearances. And also after that, we need to move toward the other aspect, that is three major histological types of lung cancer. We need to give the histological features of different kind, like one is the small cell carcinoma, non-small cell carcinoma, squamous cell, adenocarcinoma is there, what is the specific finding, certain element of, in some of the, we see the formation of what we talk about in the squamous cell, we have keratin pearls that are formed. Similarly, in one of the form, we have salt and pepper appearance. So different kind of pathological finding. So the basic approach is that there are certain hand-drawn diagrams. I followed the hand-drawn diagrams of Praveen sir. He draws almost all the pathological diagrams with his hand. So I followed his diagrams, which he drawed like in this also he drawed his hand diagram of keratin pearls, salt and pepper appearances. These those kind of diagrams can be directly reproduced in the examination setting. And also it is important to draw diagram in these type of question. Histological, if we are drawing histological diagram, if we are writing the question related to histology, pathology, histopathology, it needs to be accompanied by the diagram. This also follows in the previous questions also that we have discussed, that if whenever possible a diagram is must. The D part is related to describe the classification of cervical intraepithelial neoplasia, squamous intraepithelial lesion. Write a note on the role of human papilloma virus in the pathogenesis of cervical carcinoma. Cervical carcinoma is a part of syllabus in pathology. So basically, we have to talk about different type of CIN. Like in situ, we have CIN1, CIN2, CIN3. What is the extent of involvement in different type of CIN and how it is related to metastasis. We have to do classification on the basis of involvement, and after that we move to the second part, that is role of human papilloma virus in pathogenesis of cervical carcinoma. We have studied that how different kind of protein like protein E6 I think or E7 is there, how they affect P3 hormone, how they cause kind of mutation in P3 and retinoblastoma RB gene, and they trigger the process of metastasis. The process of metastasis is also a repeated question that has been asked. All the component of metastasis that we used to study. This question is from forensic medicine, that is classify poison based on the chief symptoms. Describe the legal duties of a medical practitioner in a case of suspected poisoning. Like classify poison based on the chief symptoms. This has been asked in the previous year also, the classification of different kind of poisons. This question has been asked, and also certain specific poisons are also asked. I will show you the syllabus of forensic medicine. Forensic examination of injuries and wounds, examination of blood and seminal stains, poisoning, sedative, overdose. Poisoning is a broader heading that has been mentioned. And we have to study a broader principles of poisoning. And after studying that, we need to go into the individual poisons that are common, like arsenic poisoning, mercury poisoning, etc. Those topics that are relevant for our professional examination, the questions related to poisoning that are asked in our professional examination. So in that question, what is the classification of different kind of poisons on the basis of clinical symptoms? So we can classify on the basis of different, there will be a exact classification, but like how I approach this question is that there can be cardiac poison, there can be a neuropoison, there are certain spinal poisons. etc. So on the basis of clinical, we study different kind of poisons that affect different organ system and how these effects on different organ systems manifest as a different clinical systems on the basis of chief symptoms. So we can go like certain sedatives might be there certain hypnotics might be there. So this can be a classify, and also there must be, if we see the standard book of forensic, there will be a classification on the basis of chief symptoms. Although if you do not know as of now what is this exact classification on the basis of chief symptoms, now it is our duty to study this classification on the basis of chief symptoms. Now the second part is also that is related to the legal duties of medical practitioner in a case of suspected poisoning. What are the legal duties? First aid needs to be provided. Second is related to the sample needs to be preserved. Different kind of samples need to be preserved, and also whether do we need to inform the police for a suspected case of poisoning, and if possible we can also accompany this with the different kind of provisions of BNSS or BNS that are present at present, because this question can be asked again in the future years also. So we can accompany this with different kind of sections that are present in BNS, which puts a legal obligation on medical practitioners in the case of poisoning. Now this ends our fifth question, and moving to sixth question. Describe the approach to laboratory diagnosis of chronic myeloid leukemia chronic phase. Leukemia is a syllabus that is mentioned both in pathology as well as in medicine. So in pathology, there we know that CML is one of the topics that is asked in our professional examination and in our vivas also. So here we have to talk about what is the laboratory diagnosis of CMLs. We know there are three phases of CML: acute phase, chronic phase, and also accelerated phase. Here they have specifically also about chronic phase and its laboratory diagnosis. So we can proceed in this question in a stepwise direction. First, we can give the clinical findings. Although it has been not asked explicitly, we can give certain clinical findings in the case of CML. After that, we can move for the basic blood findings like hemoglobin level, TLC level, DLC level, platelet count, etc. After that, we can move to the peripheral blood smears. What will be the findings in the peripheral blood smears? After that, we can move for the bone marrow aspirations, and after that, we can move for the immunohistochemistry, etc. And also, we can talk about how it is related to FISH, how FISH can be done, and what will be the finding in FISH. We can also comment about the LDH level, etc., how LDH level is increased or decreased in CML. If the question was not related to explicitly to the chronic phase of CML, we could have also talked about different phases like accelerated phase. What is the criteria to say whether a patient is in the chronic phase, acute phase, or accelerated phase? We can also write about this also. The second question of question number 6 is describe the gross and light microscopic changes evolved over 2 weeks. Duration in myocardial infarction. Add a note on the role of serum cardiac biomarkers in the diagnosis of myocardial infarction. The challenge with this question is that this is the 10-mark question. And also to remember all the microscopic changes that occur in the case of myocardial infarction is difficult, and to reproduce this question in a limited time is also difficult. But since this question has been asked repeated times, we need to aware about the exact findings, and we should be able to reproduce those findings on paper in the limited given time. And also this question, the main exercise in this question is related to how to manage our time, because in this single question we have to also talk about what are the microscopic findings. We have to give first at the 0 hours, then half an hour, then 4 hours, then 12 hour, 24 hour, 7 days, 14 days, 24 days, and different point of time up to 14 days we have to give that what are the microscopic changes. And on the second we have to, and it will be on the second we have to talk about cardiac biomarkers, different kind of cardiac biomarkers like troponins, like CKMB, like myoglobins, how they are important for diagnosis of myocardial infarction. We can also talk about which is the most importantly used in the clinical settings. And if I show you the syllabus that which is the part of syllabus where it is directly mentioned, if we see the syllabus of pathology, Inflammation and repair is a syllabus. Pathogenesis and histopathology of rheumatic and ischemic heart disease. These are two very important topics. On alternate year, they asked about whether rheumatic heart disease, the histopathology, pathogenesis, and clinical histopathology of rheumatic disease or ischemic heart disease. So these are very frequently repeated questions. Rheumatic heart disease and ischemic heart disease. So we need to be exactly aware about what are the basic findings of on microscope of ischemic heart disease as well as rheumatic heart disease. And if we talk about the second aspect, the question that was related to the bronchogenic carcinoma, the lung carcinoma, that is also mentioned specifically in the syllabus, pathogenesis and histopathology of bronchogenic carcinoma. Cancer cervix is also mentioned in the syllabus. So we see out of the syllabus, the questions that were asked in 2025 were ischemic heart disease, bronchogenic carcinoma, and cancer cervix. Now we move to the second question, the next question. This is the question of pharmacology. Explain why beta blockers should not be given to diabetes patients who are on oral hypoglycemic agents. This question that how it can mark. We studied this during our viva bosses as well as professional examination also, that how beta blockers in the patient of diabetes can block the warning signs. So it should not be given, or it should be given by keeping in mind what can be its consequences, and we should explain to the patient also that we study. And also the next time they can ask that how beta blocker should not be given in the patient of asthma. These are the kind of reasoning question. In a pharmacology section, they often ask the question that are related to reasoning, that why this should not be done, why this should be done. So this is also related to that part of questions. In certain question they have asked that how this particular drug should be given after the meals, why this drug should not be combined with this particular drug. So in the syllabus of pharmacology, first we will study that what are the mechanism of action, side effect, and side effects of different kind of drugs. And after that we also need to go towards the reasoning kind of question that we used to study during the prof examination, that why this particular drug should not be combined with this particular drug, what will be the impact if we combine this drug with the other drug. So that kind of reasoning questions are also asked very frequently. The second question is also a kind of reasoning question. Explain why folic acid is given with methotrexate. We have studied that methotrexate, and also methotrexate, the syllabus that is mentioned in that is syllabus is mentioned is that of anti-cancer drug. So methotrexate is also one of the anti-cancerous drug. So out of that they have created the question that why folic acid is given with methotrexate and how it blocks the pathway. The answer would be that it blocks that particular pathway and it can ultimately result in the deficiency of the folic acid. So we need to supplement folic acid if the patient is on treatment with methotrexate. The next question is related to a 12-year-old child developed fever with multiple crop of vesicular rash starting from face spreading towards the trunk. Mention the mode of transmission and spread of probable viral agents. Prepare a flowchart of course of infection in humans. Mention 3 tests for laboratory diagnosis of agent. Discuss the post-exposure preventive strategy. When we study about different kind of herpes virus, we study about chickenpox, we study which virus have centripetal spread, which virus have centrifugal spread, how to differentiate different kind of viruses based on their clinical findings. Like we study appearance of different kind of rashes. So this question is related to herpes virus is also mentioned in the syllabus of microbiology, other virus being the dengue virus, and one other virus is also there. So this is also directly asked from the syllabus. We need to study different kind of herpes virus. In the previous year, the question was asked that what are the different kind of herpes virus and what are the cells in which they lie in their dormant state. Different kind of herpes virus lie in dormant state in different kind of cells. So that's what is the question that was asked in earlier year. So the herpes virus has been also a kind of repeat question. So we can understand that we are not having a detailed discussion of each and every question. Basically, we are trying to understand that what was the source of different kind of question that was asked, what were the syllabus from which this question was asked. This is our basic approach of this session. Basically, we can talk about, discuss the post exposure preventive strategies, different kind of therapies like with there, like on the basis of different drugs, so that can be written. The next question is that of enumerate the malarial parasite prevalent in India. Of them, which species is notoriously associated with life-threatening complication? What are the different characteristic peripheral blood smear findings in the different species of parasites that causes malaria? We talked about there are three parasites that are mentioned. One is that entamoeba histolytica. Second is giardia. Third one is the malaria. The question is related to malaria. We have to enumerate different kind of malarial parasite like vivax, falciparum, malaria ovale, etc., knowlesi. And after that, we have to answer that which species is notoriously associated with life-threatening complication like brain fever is there, black water fever due to Plasmodium falciparum. We can also explain that what is the process of different life-threatening that are caused due to Plasmodium falciparum, like acute kidney injury might be there, like black water fever might be there. So different kind of life threatening complication can also be enumerated in brief, and we can also answer that which species is that. Now this question, if we see what are the different characteristic peripheral blood smear finding in different species of parasite that cause malaria. See, when we study about different kind of peripheral blood findings, like there are different kind of dots like Geman dots, James dot, etc. And also there are different shapes of gametocytes, etc., like banana shaped gametocytes. But it is very difficult to remember what is the exact finding in different kind of parasite, that how peripheral blood smear finding of Vivex is different from falciparum. So it is a bit, I will say it is a difficult question. We can write overall findings, what will be the overall peripheral findings, like different stages will be there, what different findings will be there. But to individually write findings in different malaria species is a difficult exercise. The seventh question is related to forensic. The first part is related to forensic. Define drowning. Enumerate the different modes of death and ease of drowning. List the post-mortem findings in a case of wet drowning. So in this drowning, we have to explain, we have to define it. And also we have to enumerate the different modes of death. Like it depends on whether the drowning is in the salty water or it is in the fresh water, how it can affect the equilibrium of the body, like equilibrium of the blood. And after that, we need to talk about how dry drowning is also there, because there is a contraction of larynx, how stimulation of vagus is also responsible for death in many cases of drowning. So we need to enumerate different modes of death that can occur due to drowning, because ingestion of water or when water goes to lungs, this is one of the causes. There can be other causes of drowning also. One is that even after the patient has been rescued, there can be a pneumonia that can occur in the patient of drowning. And also the second is related, the question is related to list the postmortem finding in the case of bed drowning. What are the different kind of findings? The lungs will be voluminous, there will be marking of ribs, hemorrhage might be there, peltops hemorrhage will be there. So different kind of findings will be there that needs to be written. There are many findings. Describe diatom test and enumerate its limitation. In drowning, we basically study two type of tests, that is related Jettler test and diatom test. In Jettler test, it is related to the chloride level in the left side versus right side of the heart. And second test is related to diatom test, because we study that diatoms have covering of silica, and they are resistant to the acid that are present in our GIT, and these diatoms ultimately reach to the bone marrow level. So it can be helpful in identifying that what was the source of water, from where this water came. And the limitation that we study, it's limitation that the patient might be consuming the water from that very source from where he or she drowned. So these are the limitations that it we study, that also it is not very sensitive in nature. Also, it requires a lot of infrastructure and technical expertise. These limitations can be written. This question is of pathology. Enumerate four major primary glomerulonephritis presenting with nephrotic syndrome. Describe pathogenesis, slight microscopic immunofluorescence, and electron microscopic findings of post-infectious glomerulonephritis. This has been a repeated questions every year, probably, or every alternate year. They asked the pathogenesis, light microscopic finding, immunofluorescence, and electroexamining finding of one type of glomerulonephritis. It can be MPGN, it can be post-infectious glomerulonephritis. That keeps on varying, but they are asking under these headings only: light microscopic, immunofluorescence, and electron microscope. This is also mentioned directly under the syllabus. Describe the state of wound healing by first intention. Enumerate factors that influence tissue repair. Wound healing is a part of syllabus. We have to write that what are the various steps of first intention. There are two type of wound healing, that is by first intention or second intention. What is the difference between healing by first intention? What are the difference by healing of second intentions? And second part is related to enumerate factors that influence tissue repair. Like we have to write about the factors: what is the blood supply, what is the extent of injury, whether the patient is under any kind of steroid, whether that wound is infected or not, whether any kind of, what we can say, the blood supply is intact or not. So these are the different factors that affect tissue repair. So that needs to be written in this particular question. This question, next question, is related to describe the role of nitrates, the route of administration, and their side effect while being used in management of angina pectoris. So we need to write about the role of nitrates, what will be the mechanism of action when nitrates are given in the case of angina pectoris, and what will be their routes of administration, and afterwards side effects also need to be written, that whether it can lead to the lowering of blood pressure or not, whether it need to be given sublingually or not. So these are the various aspects that need to be addressed. So remember, for 5 marks question we usually get 1 page, and for 10 mark question we usually get 2 pages. So this whole answer needs to be written in 1 page. So if we see, the question number C has 3 component, 3 part, 3 subparts. Each of subpart is at a 5 number each. And so that means that we will be getting 1 page for each of these questions. The second question is that to discuss in brief the mechanism of action and therapeutic use of exenatide. Exenatide, we know, is a drug that is used in diabetes. It is a GLP-1 agonist, if I am correct. So we need to write what is the mechanism of action, what is the therapeutic use, where it is used, type 1 diabetes, whether it can be used in type 1. If it is not used in type 1 diabetes, it is basically using type 2 diabetes. Therapeutic uses, what are its therapeutic uses? Like other than diabetes also, are there any therapeutic uses that are under research? So that components need to be addressed. Oral hypoglycemic agents are mentioned in the syllabus of pharmacology. Enumerate the advantage of artemisinin based combination therapies in the treatment of malarias. We need, there are different kind of ACTs, and what are the advantages? We combine different kind of long acting drugs with the short acting drugs. So each of these combination, each of these part of these combination serve a different kind of purpose. How, like one therapy we study that is long acting, other is short acting. So this is how we had to enumerate the advantages of artemisinin based combination therapy, and also we need to answer that how it can be used in certain drug resistance strains, also certain drug resistance strains of plasmodium, etc. We have to enumerate these advantages, etc. Second, I will also see you the kind of the topics from the syllabus where this question was asked. These questions were asked. If we see pathology, pathogenesis and histopathology of cirrhosis, pathogenesis and histopathology of cirrhosis of liver, glomerulonephritis. This was the source of question that was related to glomerulonephritis, histopathology and pathogenesis. This was directly from the syllabus. And I was discussing about that in microbiology, humoral and cell mediated immunity is part of syllabus. And also herpes was asked, salmonella was asked this year, malaria was asked. And if we see the forensic syllabus, drowning is mentioned as a keyword, and this was from where the question related to drowning and various causes of death in drowning, various findings. This was the source of these questions. And also in pathology, we see inflammation and repair. Inflammation and repair, this was the source of the question that was asked related to primary healing by the primary intention and what are the factors that affected the healing by primary intention or by secondary intention. So this inflammation and repair, this was the source of that question. Now moving to the last question, that is question number 8. I did not attempt this question because the first part of question I found it difficult to answer. That is, describe the challenges of circulating vaccine-derived poliovirus. Add a note on environmental surveillance and preventive strategies for effective maintenance of polio elimination. Polio is the other virus that is mentioned in the microbiology, but we study this uh, VD-PV and vaccine-associated poliovirus in our community medicine also. How these two are different, how VD-PP is different from VD-AV, which are different kind of strains where VD-PV is found, which are strains where VD-AV is found. Although we do have certain idea regarding different kind of strains that can lead to these kind of situation, but to answer in 10 marks was a bit difficult, so I did not attempt this question. Also, we do not have the exact idea that what are the procedures for maintaining the environmental surveillance and what are the preventive strategy for effective maintenance of polio elimination. We have the basic idea, but I was not having the exact method of environmental surveillance, so that's why I did not attempt this question. The next question that is related to describe the mode of infection and clinical manifestation of cryptococcuses and describe the role of rapid diagnostic test in comparison to conventional technique for identifying the infection. Cryptococcuses is also mentioned. Cryptococcus along with Candida and Aspergillus is mentioned in the syllabus under the heading of fungus. And also we see cryptococcus is also a repeated question. Most often we see a question because in bacteria syllabus, Neisseria meningitis is given. So most what happens many times the question is given in the form of clinical comparison between meningitis due to Neisseria meningitis and the meningitis that is caused due to cryptococcosis. So kind of comparative question is asked similar to the question that is asked between difference between bacillary dysentery and amoebic dysentery. So a kind of this kind of question is also asked on the basis of clinical scenario. We have to give the mode of infection, clinical manifestation of cryptococcosis, and after that we have to give the role of rapid diagnostic test in comparison to conventional techniques for identifying the infection. There are different kind of culturing techniques that we study, the kind of conventional techniques that are used for identifying the infection. So we need to we need to write down what is the role of rapid diagnostic test and how it can be compared with the conventional techniques. The next question is related to injury hurt and grievous hurt. This is a question, a kind of frequently asked question is in our professional examination as well as our viva also, that define injury, define hurt and grievous hurt. And also all these needs to be defined with the changed nomenclature as well as BNS, BNSS. What are the different sections under BNS, BNSS that define the injury, that define the hurt, and that define the grievous hurt? I think there, as far as I remember, there are 8 components of grievous hurt. These 8 components has also been asked in the previous questions, that what are different 8 components of grievous hurt. We have to write word by word that these are the component of grievous hurt. Add a note on the medical legal aspect of continuous. Remember, I show you that examination of wound and injury is a part under forensic medicine. So we have to write about contusion and what can be the medical legal aspect of contusion. Like whether it can be related to grievous hurt, the contusion of which areas can be related to grievous hurt, or it can be related to grievous hurt at all or not. There are other aspects of contusion such as hidden contusion or delayed contusion, how it is related to medical aspect. So all these things need to be written. And also we can write about what is the basic pathology of contusion, how vessels are injured, how it lead to the accumulation of blood. This can also be written. And also in contusion, the color changes also become important. It has been asked in the previous question that color changes with time. How color changes, this has also been asked. Describe the various tests prescribed for blood and seminal stains obtained during the examination of a victim of rape and their role in the investigations. I showed you that blood and seminal stain examination is part of syllabus of forensics, and also examination of a victim of rape is also question that has been asked multiple times. So we need to aware about what is the exact steps that need to be followed, right from acceptance of consent, and ultimately we talk about what kind of treatment need to be provided to the victim. So we need to write all the steps, and also we need to write about the consent. We need to write about the treatment that needs to be provided to the victim. And also for the blood and seminal stains, there are different kind of tests. One are some tests are of confirmatory nature, certain tests are not confirmatory, so that different kind of blood and seminal stains test. And also in that test, like different kind of crystals are formed. So if you could draw the diagram of different kind of crystals, certain rhombic crystals, certain crystals of different colors are formed, certain UV based tests are also done. So we could draw the diagram of those crystals. That can also be done. Enumerate the drugs used in the management of hypertensive crisis. Also describe the route of administration and their side effect. Basically, here we have to give different kind of drug that can be used in hypertensive crisis, and also describe the route of administration and their side effect. This is directly from the syllabus, right? The pharmacology syllabus says the antihypertensive drugs. So different classification of antihypertensive drug like calcium channel blocker, the whole pathway that is affected in hypertensive, renin angiotensin pathway. So that classification needs to be memorized. And also this question, since the question is explicitly asking about hypertensive crisis, so different kind of drugs can be used. We study different kind of drug like labetalol is used. There are other kind of drugs that are also used. Previously they asked the broader classification, what are the different kind of drugs that can be used as a hypertensive. So in that question we need to write briefly about different kind of antihypertensive that can be used in that question. The last question is that name the drugs, doses, and duration of treatment after post exposure prophylaxis of HIV. See, this is also a bit difficult question, because if we see the different aspect of this question is that name the drugs, we can name the drugs, we know the what are different types of regimes that are used in post-exposure prophylaxis. Also, we are aware about the duration of treatment, but in examination setting, this doses aspect, that what is the exact dose of each drug, that creates a certain kind of confusion. So especially in the examination environment, it becomes difficult to remember the exact doses of the different kind of post-exposure drugs that are given in the case of suspected case of HIV. If there might be a needle pricking, etc. So otherwise, HIV prophylaxis is one of the important topic that has been asked previously also, but that doses aspect, it makes this question a bit difficult. However, since this question has been asked, we need to be aware about the doses of different kind of drugs that are given. So this is 2025 paper. So the basically what I was trying to say, the point that was I was trying to prove is that we need to understand that most of the question, if we see, they were covered directly or indirectly from the syllabus that has been mentioned. If we leave one or two questions, more than 90 to 95% questions were directly from the syllabus. This is the advantage that is offered by the medical science optional. And also, a repetition of question is there. There are several questions that are repeated multiple times. And if we see the question, they are very kind of direct in nature. We have right to point to point. These are the points that need to be written explicitly. So these are the certain positives of this optional. My basic purpose was to relate how this particular question paper is related directly or indirectly to syllabus. Because when I started preparing for this optional, my lot of time went to actual searching of topics that from where these questions are being asked. So the basic purpose through this exercise is that maybe in future we will come through other videos also where we will try to go into a detailed strategy of each and every topic, that what are the subtopics that need to be studied in this particular topic. So it will make this learning of medical science optional exercise a bit easier. This is the basic purpose of this, that whatever difficulty I faced in preparation of medical science optional, you should not face. It should become a bit easier for you. This was the basic exercise. This was just an introductory video. Maybe in future we will come through other videos all related to medical science optional also. So that's all for today. Thank you very much.